Hey guys, this is Ethan Preston. Right now I'm in my specialized practicum 3 program. This is a PowerPoint on motivational interviewing and what matters most in practice. Slide, slide 1, we'll look at presentation topic. Again, that's motivational interviewing is an evidence-based practice counseling approach. Used often in substance use and mental health treatment, helpful when clients feel unsure or resistant about changing. This also works well with mandated or court involved clients. Here's a definition just of motivational interviewing and abbreviation with kind of like what it really stands for. We're looking at client centered and goal oriented. Also looking at helps increase internal motivation for change. And this also focuses on exploring and resolving ambivalence and uses collaboration instead of confrontation, which I really like. Working with the client. Eventually, you keep working on motivation interviewing, and the rapport just continues to build. I'm a big fan of this and really love using it in therapy. So, why motivational interviewing matters in substance use disorder and mental health therapy. Again, ambivalence is common in addiction and recovery. Relapse risk increases when motivation is low. So, again, that identifies that motivational interviewing helps motivation levels. Interviewing strengthens engagement and retention in treatment. Motivational interviewing reduces resistance and power struggles. Again, this is just another great example of this evidence-based therapy that can allow you to work with the client, and this feels like a more of a team. You're building with them. Um, it's a great practice. Spirit of motivational interviewing, how we show up. Collaboration, work with the client, not against them. Like I said, this should be a cohesive type of thing. Acceptance, respect autonomy and choice. It's our choice as professional social workers to understand where that client's at. And sometimes we do have to accept and respect. I love that. Compassion, act in the client's best interest. This goes right back to client's right to self-determination in our NASW code of ethics. So, I mean, that compassion part, huge. Evocation, draw out the client's reasons for change. I'm a big believer in writing things down and the power of that and kind of believing in that. So, again, this is big stuff that I use weekly, sometimes daily with clients. So here's a really easy way to really use this. It's really helped me a lot. My supervisor helps me with this. I've learned this really from my bachelor's program on to until now, and I continue to use this. This is a good starting point. It's called Core Skills ORS, right? And it's called open-ended questions. So that's kind of like where you're going with the client using open-ended questions. Affirmations, reassuring that client. Uh, you know, uh, you can also mix in strengths perspective into this. With those affirmations. Reflective listening. Tell the client what you're hearing. Not just but also engaging, allowing the client to understand that you are listening. And then I always do this at the end of my sessions, regardless if I use motivational interview or not. I summarize the end of the session. That allows the client to, I believe, feel validated and feel like they've been heard, which again makes your sessions feel valuable to the recipient of the session. So for me, oars, you can't go wrong with following this. This is very important and key to motivational interviewing. So sometimes we have a hard time putting this into perspective, but what does motivational interviewing sound like? So here's some examples. So if I'm sitting with a client, I would ask them, what concerns you most about your substance use? Or another example, it sounds like part of you wants to change, but part of you is scared. Another example, you've shown a lot of strength by staying in treatment. Again, empowering the client. Another example, let me summarize what I'm hearing for you. And again, that follows the ORS structure right there. So that was a good example. And if you have any other questions about this, please feel free to reach out. So on this slide, we have change talk versus staying talk, and we'll go into this a little bit. Change talk equals reasons for change, client language. This is the client talking. Sustain talk equals reasons to stay the same. Motivational interviewing listens for both without arguing. Again, this is a non confrontational intervention. This is a very empathetic, sympathetic. This is a very softer approach in therapy, especially when you have those court mandated, treatment resistant clients. This is a great strategy, but again, it's about really hammering down on what the strategies that you need to learn to use motivational interviewing, and using it, but not just for 10 minutes of the session, but for the entire session. I think that's what's most important. We can veer off sometimes. Staying focused on what you're using in therapy for me has been the most important part, is staying focused on motivational interviewing throughout the whole session, not just 15, 20, 30 minutes, but a whole hour. Motivational interviewing and stages of change. Again, this is from Prokaska and DiClemente. I really like this. I teach my clients this all the time. Just the stages of change. It really helps put into perspective kind of like where someone's at, and they can gauge where they're at. Sometimes if they're in that pre contemplation stage, meaning they're not ready, they might not even recognize what the stages of change are, or be willing to be open minded to this concept. But and then we move into the contemplation. They're just unsure. Maybe they feel some type of confliction within themselves, knowing that they should be getting help, but they want to keep doing drugs at the same time. So they're still contemplating about it. So preparation. Now I've made the plan. I'm planning. I'm planning. I'm planning action. I'm moving in. Change the behavior. The behavior has changed. I'm going. Maintenance is staying consistent. Maybe that's remission. Maybe that is, sustained remission, obviously, in substance use disorder programs. But big fan of Prokaska and DiClemente. Again, stages of change for motivational interviewing, highly effective. Motivational interviewing and dual diagnosis work. In this, it explores ambivalence about sobriety and mental health treatment. Again, support medication adherence without shaming. Without shaming. Another bullet would be increase follow through with therapy and groups. Again, if someone's, especially when they might assess at a higher level of care, they need those extra services. They need those groups. It's very essential that they get them. Helping clients link goals to daily choices. Again, that is key. So now we have motivational interviewing with mandated court-involved clients. Again, this is very important because this is a lot of people get mandated or court-involved clients, whether that's CPS, whether it's substance use disorder, whether it's in the hospital with mental health. Avoid arguing about the mandate. That's not the relevance of why they're here. Again, and it's not productive for motivational interviewing if you're arguing. Focus on what the client wants. Is it freedom, stability, family? They want something or they would not be there. Use reflection to reduce defensiveness. That's a key one, is to use that reflection. Again, they might make you feel like you're on the fence. They might make you feel, okay? Just because you feel doesn't mean you respond. And I like to reflect if I feel that way. Okay, now let's give me and this client a moment. They can cool down. I can reflect and summarize on what they're saying. And then we can get back into a nice, cohesive, nice, even frequency to where there's no, you know, something in the air to where the client doesn't feel comfortable. Um, Support compliance while keeping dignity intact. Again, you're wanting to set a good example for these clients. So support that compliance and keep that dignity intact. Summarize at the end of those sessions. Make them feel empowered. Ethics and professional responsibility. Motivational interviewing supports self-determination and dignity. Again, as we've already said previously in the slide, huge one. Again, this next bullet is social workers must practice within competency. Again, that just falls into basics of being a professional social worker. Another bullet, motivational interviewing requires training and supervision. Again, the things that I've described here and explained here are not things that I just knew right into the field. These are things that I've picked up, that I've had to learn, that I've had to refine. I'm going to continue to refine so that way my sessions and my clients are getting the best version of myself and in therapy. Because again, we're coming down to what is the client's outcome? What does the client want? And if I am not educated or continue to educate myself in different styles and ways and techniques to use motivational interviewing, then I am failing myself and my client. So not only that, our next bullet, motivational interviewing requires training and supervision. I just said that. Documentation must reflect accurate clinical work. That is key, and that's something that I've really focused on in this master's program because I understand the parameters of obtaining a licensure such as an LISW or an LSW or any other licensure. You work so hard for this, the last thing you want to do is lose it because you don't have good documentation or you're not following the NASW Code of Ethics. So benefits of motivational interviewing. Again, this is an evidence-based practice. Anytime you see an evidence-based practice, for me at least, this is something I want to read about. This is something I want to learn about. This is something I want to ask my supervisor about. This is something I want to ask my colleagues about. Because if it's an evidence-based practice, that means something about this is working. So I need to learn how to use it the right way. The next bullet, this improves treatment, engagement, and retention. Love that. That's a huge one right there. Another bullet, works across many substance use settings, and not just substance use. This also works in any other, like if you're working with children especially, this is a great therapy to use. Flexible in individual and group formats. So these are some common motivational interviewing mistakes to avoid. Again, arguing. Never, ever, ever argue with your clients. You are not setting the tone by making yourself superior to your client. That is not therapeutic. Giving too much advice without permission. I think that that's key to learn as a therapist. Like, this isn't the you show. This is about the client. Talking more than the client. Don't do that. That's just, I've caught myself doing that, and sometimes I still do that. But I think that's something that we have to continue to try to work on and to learn about. Is what you're saying being valued? Is it being taken in by the client? Or are you, making this session a you session, as I say? I think that that's very important. Using confrontation as a main tool. Anyone that goes into any situation, even if the client did something wrong, and you go in confrontational, that's never going to end the right way. So, with that being said, again, those are some mistakes to avoid. Simple action steps for practice. Bullet one, use 2 to 3 reflections for every question. Bullet two, ask permission before giving advice. That's always key. It's critical because I have had that happen. I have done that, and that client didn't want the feedback. So be very careful with the feedback and how you are delivering that. Another one, listen for change, talk, and reinforce it. You always want to give that positive reinforcement anytime you can give that affirmation. You need to do it. End with a short summary and next step. Again, that's something that I use and implement in all of my sessions. I feel that very valuable, and I think that all the clients really respect that. So again, these are some really good tidbits on motivational interviewing and how you can start using this in practice. And not only that, but it's an evidence-based therapy practice that you can use not with just children, but adults, not just substance use, not just mental health. This is, I mean, just really groundbreaking stuff. You can mix this with a little bit of strengths perspective, I think, and also, just following the outline of what fits into motivational interviewing. This was a blast giving this presentation because this is actually something that I use in practice. I'm very passionate about it, and I believe that it works. So I hope you've enjoyed it. You can review my reference page and pull anyone you like. If you have any questions, please reach out. Again, my name's Ethan Preston. I'm a UPike undergrad student, and really looking forward to seeing what I can get back to the field. I hope you guys have a wonderful day. Enjoy your evening.